Hello, my name is Makenna Piaskowski, and I'm currently a junior at Immaculata University. I'm in the honors program, and for my honors colloquium class, I chose to write my paper and do my final project on the effects of social media on teens and their mental health. The majority of teens today use at least one social media platform. Social media use is rapidly increasing as time goes on. With that being said, it is important to consider the effects that may have on teens, both positive and negative. While their brains are not fully developed, the things that teens are exposed to can influence them more heavily, which includes the content that is put out on the social media platforms they are using. Social media use is especially prevalent in teens. According to Vogels, Watnick, and Monserrat, 97% of teens said that they use the internet daily. Teens are exposed to content that can make them feel negative on the social media platforms they use. This includes comparing themselves to others, feeling like there is a perfect body type, and they also can be affected by the amount of likes that their posts get and compare that to others. These feelings that they have can lead to mental health issues and other negative symptoms, such as anxiety, depression, self-harm, poor body image, suicidal thoughts, eating disorders, hopelessness, and more. There has been a multitude of research and studies done in relation to this topic. There are a few important points that are worth mentioning that help make my case about social media impacting teens. Research has shown links between social media use and poor body image, low self-esteem, and mental health issues in teens. Mills, Shannon, and Hogue found that experiencing body dissatisfaction can be the highest risk factor for many unhealthy behaviors. The high use of social media in teenagers and young adults could increase their body dissatisfaction. Seeing others' posts can make teens feel like they have to conform to different social constructs. According to Giozza et al., this can lead to eating disorders and low self-esteem, among many other issues. Additionally, research has also found that large amounts of time spent on social media has been linked to higher suicide risk for teen girls. Lastly, in the United States, suicide rates in the 12 to 16 age group have increased by 146% between the years 2009 and 2019. I decided to compose a short survey aimed at high school students who are in their teens to collect some data about the effects that social media has had on them. There was a total of 75 participants ranging in age from 14 to 19 years old. Some of the questions that I asked included the social media platforms they use, if any, if they wish they were not exposed to social media at such a young age, if seeing others' posts made them feel negative in any way, and if they did experience any negative effects from social media, do they feel that the positive effects outweigh the negative? This just included some of the questions that I asked, but there were others also. From my survey, 97.3% of participants stated that they use at least one social media platform. In my survey, I also asked teens if they have ever felt any of the following symptoms as a result of using social media or seeing others' posts on social media. The results were as followed. 42.7% said they felt anxiety from social media. 28% experienced depression. 26.7% experienced hopelessness. 16% experienced eating disorders. 8% experienced suicidal thoughts. 4% engaged in self-harm. 4% felt thoughts of harming others. 12% preferred not to say. Other was 3.9%, and not applicable was 39.9%. It is important to note that while there is only a low number of teens who experienced self-harm or suicidal thoughts or actions, that it is greater than zero. While this group may not be the majority, they are still important. There are cases that I will mention a little later of teens who have committed suicide as a result of social media, which will help bring awareness to the group of teens that have engaged in suicidal thoughts or actions relating to their social media use. From my survey, as well as in research done by professionals, some teens reported engaging in suicidal actions or self-harm as a result of social media use in some form. This coincides with real-life cases of teens who committed suicide because of social media. There is the potential for teens to plummet into a downward spiral of negative effects from using social media, to the point where it can get out of control and they take their own lives. One issue that I have found during my research is the way that algorithms work. Algorithms are programmed to show users certain posts that are similar to other posts that they have viewed. This is because the platforms want to keep users engaged and interested. However, in some cases, these algorithms proved to be more harm than good, showing teens depressive and disturbing posts. Another issue is that social media companies are accused of not placing enough safeguards in place for teens, which in turn can cause negative effects on their mental health. Two cases of similar instances that I will highlight are the cases of Selena Rodriguez and Molly Russell. The first case study that I highlighted is the case of Selena Rodriguez. Selena was an 11-year-old girl who committed suicide due to the effects she felt from social media use. She struggled for over 2 years with extreme addiction to Instagram and Snapchat. Selena's excessive use made her depression much worse, especially during the time of the COVID-19 pandemic, when everyone was on lockdown. At one point, adult males began soliciting her for sexual content over social media platforms. Selena fell into the pressure to fit in and look a certain way, and ultimately began giving these people what they wanted. These males were able to do so as a result of Instagram and Snapchat's lack of identification and age verification. Within these platforms, there is also an option to make messages disappear, which gets rid of any proof of identification for these people. Images that Selena sent to these men were eventually leaked and spread around, making her feel even worse about herself. As a result, she was hospitalized for emergency psychiatric care. It was reported that Selena had experienced poor self-esteem, self-harm, eating disorders, mental health issues, and more. She ultimately committed suicide from the weight of these symptoms. In response, the Rodriguez family filed a wrongful death lawsuit against both the Meta and Snap companies, claiming that there is a defective design on their platforms, which include dangerous features that played a large part in Selena's suicide. Selena's case is just one that highlights the pressures that can be felt from using social media platforms that can turn out to be detrimental if things do not change within the platforms. Molly Russell's case is the second that I chose to highlight. Molly was a 14-year-old girl who also committed suicide due to social media algorithms. To her family, Molly seemed happy and normal. However, on social media platforms, she was engaging with depressing posts. Once Molly viewed just a few posts like this, her entire feed became filled with suicide-related and disturbing material that was fed to her by the algorithms in place on the social media sites. Her family reported that she was even receiving emails that contained this harmful content even after she had taken her life. Professionals who had examined the content Molly was receiving said that it was obvious how this would have made her depressed and hopeless, ultimately leading to her suicide. An article by Lynch, 2022, reported that shocking and unsettling content can release amounts of dopamine that can cause users to keep scrolling through negative posts. This is unfortunately what probably happened with Molly. Molly's case was the first instance where social media was to blame for the suicide of a teen, as well as the first time a social media company has been adjudicated to be a cause of child suicide. Officials from both Pinterest and the Meta companies argued that the content Molly was exposed to was harmless. It was reported by a Facebook whistleblower that big social media companies like these only care about the amount of users they have and the amount of money they make. It was revealed that if these companies put restrictions in place so people are not exposed to harmful content, the amount of users would decrease. This is what they base their decisions off of. Molly's case is another example of social media use leading to suicide. If more awareness can be brought to cases like Molly's and Selena's, hopefully social media companies will be influenced to change their policies. This is important because millions of people, not just teens, use social media on a daily basis. What is put out on these platforms can have a large influence on people's minds. This is especially true for teens whose brains are still developing functioning skills. Their minds are more impressionable and are prone to making choices without considering the consequences. This is also important because there is a lot of evidence to support the claim that social media can affect body image, mental health, and self-esteem in teens. It is not just a baseless claim. There is lots of research to back it up from professionals. The survey I conducted even supported this claim. As the age at which people begin using social media continues to get lower, it is important that the content individuals see is age-appropriate and not suggestive of harmful ideas that can cause them to act negatively. After knowing all of this information, what's next? It's important to consider what can be done to prevent teens and society as a whole from experiencing negative effects from social media use. This can be a great opportunity for social media companies to change the way that their platforms work. They can put restrictions in place so that users, especially teens, are not impacted negatively by what they are exposed to. Attention brought to the topic can help raise awareness and may influence companies to take action. Additionally, publicity from news outlets and individuals sharing stories are other ways to spread awareness. Lawsuits against companies can push them to make changes, like in the cases of Selena Rodriguez and Molly Russell. Holding companies accountable can save children in the future. If more awareness is brought to the topic, individuals may feel more comfortable speaking out about the experiences that they have had due to social media. Lastly, bills and laws can be put in place that protect teens who use social media. Overall, this is not something that should be taken lightly. It is affecting the youth of our country by exposing them to things that they should not have to worry about at their age. Raising awareness and taking action are the best ways to spark change in this situation. That's it for my project. Thank you so much for listening. On this slide, all the sources are listed that I used if you're interested in checking those out. Thank you.